What's going on, everyone? I am just a typical, average American here today to react and learn about some graphs and data that show how healthcare in Norway is better than healthcare here in the United States. So, here in America, I actually think that the care that we get from hospitals and at the doctor is pretty good. I've always had a good experience. It's really our crazy healthcare insurance system that's really bad and very, very confusing. So today, I want to take a look at these graphs and learn about some of the ways that Norwegian healthcare is actually better than American healthcare. So let's take a look at these, starting with number one, life expectancy at birth. So we have Norway in red and the United States in blue, and Norwegians live like 5 years longer on average? I mean, I can't actually say that I'm that shocked when you think about it. Here in the United States, like, we are known for being unhealthy. Our food is so bad and processed with all these crazy chemicals and preservatives and dyes, stuff that I'm pretty sure is illegal in other parts of the world. We're eating, and our health habits are not good. And Americans don't prioritize health. Whereas Norwegians, you guys like get outside and go on hikes and stuff, right? You actually walk on public transport. You actually use your legs and move. So Norwegians live longer on average. That doesn't shock me. I think it's just the number of years. Like 5 years more of life. That is that is not a small number. I wonder. I'd like to know like more specifically why exactly that is. Like what. I have some ideas, but that's pretty shocking. Like Americans should be really alerted by that. Let's keep going. Infant mortality. This is babies' deaths at less than 1 per 1,000 births? What? Norway has one of the world's lowest infant mortality rates. So this is the rate at which newborn babies die, which is a pretty like dark statistic, but this certainly says something about our healthcare. Is the US very different? In Norway, you have 1.5 infant deaths. That's a child under 1 year old. Like 1.5 out of 1,000 children, which is, we wish it was zero, but that's pretty good. In the United States, it is 5.6. Wait, that means like, that is horrible, especially when you compare it to Norway. That's like 4 times worse. That's like 400% worse. 400% more baby deaths. Am I understanding this right? No, it says about 273%, but it's about 1.5 versus 5.6. That's like about let's say 4 times more children, babies under one, dying in America. Why? Why is it what? I thought our care was pretty good. I'd love to know why exactly this is happening. That is shocking. Maybe Norway is doing some really like amazing things. Maybe your technology is different. Maybe your procedures are different. I don't know, but that's horrifying. That America is that much worse at keeping babies alive, like infant mortality. Oh my God. Preventable mortality. Preventable? So these are deaths that are preventable. These are people that have conditions where you don't have to die. Preventable. Public health and prevention systems help Norway keep preventable deaths much lower. So Norway has 105 people out of 100,000 pass away from preventable deaths. That's a very sad stat, too. These are conditions that are survivable, but you end up dying. You slip through the cracks of the system, or you don't get the care that you need in time, maybe. Oh God, in America, it is about twice as worse. 238 per 100,000 people die of a preventable illness or condition. Whoa. Lower preventable deaths suggests stronger health and prevention. This is like tobacco, alcohol, road safety, vaccinations. Oh, it's a lot of different things, just all around conditions and deaths that could be prevented with better education, better systems, like to prepare before you die, like intervene, like before you're already on death's door. Sounds like Norway's healthcare system is just more advanced, more educated, more, getting ahead of the problems instead of just waiting for something bad to happen. I think we could learn a lot from Norway. That's what I'm getting here. Population reporting same day or next day doctor access. Norwegians are more likely to get next day or same day appointments with with a doctor. You can get in to see the doctor the same day that you need to see them. Like that day, if you need to go in, you can. What? That's kind of unbelievable. I don't know how I don't even expect that level of like efficiency out of the American healthcare system. We're pretty good in a lot of towns and cities. You can get in to see your doctor like at most like in a week. And if it's very important, you could probably get in pretty quick, but the same day or next day, 66% of Norwegian adults can go into the doctor the next day. That's amazing. In America, it's not bad, actually. It's like 49%. I'm going to say it really depends on where you live. In America, if you live in a big city, you're not going to be able to see your doctor very quickly. But if you live in a small town or city, 50% of the time, that's actually better than I thought. That's actually not bad. Norway is just a bit better, a bit more efficient. Adults receiving recommended cancer screening. Oh, screening participation is higher in Norway. 78% of Norwegians getting cancer screenings. Good for you guys. This is teaching me, like something that really stands out is how well Norway has preventative care, like screening for cancer, educating on not to use like tobacco and alcohol, and Norwegians trying to have generally good health practices. Whereas in America, we get 64%. That's about right. They do encourage you to get colonoscopies at a certain age, women to get breast cancer screenings, but honestly, we're taught like if you feel a lump in your breast or your neck, or that's when you go in. A lot of people don't go in when they're feeling good, but you need to go in and get screened when you're feeling good and healthy. It's supposed to be preventative, like before there's a problem. And I think Norway just understands that a bit better. Population covered for a core set of services. This is healthcare coverage, which in Norway is 100%, right? Every Norwegian who pays their taxes is covered, right? You guys have like this universal, it's covered by the taxpayer money. You just go in whenever and you're covered. In America, 91% of the population is covered. That's talking about healthcare insurance. which is usually tied to your job. That's why so many Americans have healthcare coverage, because your job usually provides that benefit, even though you have to help contribute money and pay for it a lot of the time. And for a lot of Americans, they have to buy healthcare insurance on the government websites, and still 9% of Americans aren't even covered. So for them, you can't go in. Like, if you don't have healthcare insurance in America, if you go in to the hospital, it could ruin your life. That is a very, very dangerous thing to not have healthcare coverage. You could end up with a $50,000 bill if you go in and if you need emergency surgery, or that's very bad. And the fact that 1 out of every 10 Americans could have their entire life ruined and bankrupt if they get sick or hurt is pretty bad. It's pretty darn bad. This is an important slide right there. Shows a big, big problem with our system. And yeah, for the 91% of Americans, we're having to make monthly payments every month to keep the insurance going, pay your premium, and then when you show up to the doctor, you gotta pay like a copay or some money before your insurance starts taking effect. That's what a deductible is. The amount of money you have to pay, and then your insurance will start helping. There's a bunch of weird, stupid stuff like that. It's really annoying. Health spending per person. The United States spends almost twice as much per person, yet achieves worse outcomes. So, this is like how much the United States government spends per citizen. So in Norway, you spend 770 US dollars a year per person. In America, it is almost twice as much, $12,500 American dollars per year. So we are spending more money on healthcare for people. The government, or the hospitals, or whatever this is. Anyway, we're somehow achieving a worse outcome. we're spending more and doing less than Norway. And more people are dying on average. That just shows that the American healthcare system and governments are incompetent and don't know how to spend money, which is really frustrating. 30-day mortality after ischemic stroke. So this is after you have a stroke. How often people die within 30 days? In Norway, the 30-day stroke mortality is one of the lowest. In Norway, if you have a stroke, 97% of the time you will survive 30 days or more. So Norway is very good at making sure people survive these catastrophic strokes. In America, it's not bad. And that's what I would expect. I have to say, as much as our healthcare system is horrible and people can't get the care that they need, if you can go in, if you're the 91% of Americans who can get in and your insurance covers it, the actual care is usually very good. We have very, very good doctors, That's one good thing about American healthcare. 30-day mortality after myocardial infarction. This is a 30-day death after a heart attack, I think. In Norway, only 2.6% of myocardial infarctions die within 30 days. America is twice as worse, but they're both very small numbers, to be fair. Both Norway and America seem to be pretty good at treating stroke and heart attack and myocardial infarctions, and that's cool. But Norway, again, is better. I didn't know that Norway's health care, the actual care, the technology, the service, the doctors are clearly a bit better, or something else is going on here. Maybe with a lower population, maybe you guys get more attention. That's a possibility, more individual attention. That's a really big benefit of living in a smaller country. Adult obesity. Oh God. Obesity is much lower in Norway, reflecting a healthier diet, right, and active lifestyle. In Norway, 16% of Norwegians are obese. 16%. That's not great, but in America it is 42%. Almost half of Americans, almost half of Americans are severely overweight, obese, at risk for all sorts of diseases, stroke. Almost 50%, almost half. That is insane. I've heard that before. I see it when I go outside and when I'm in public, I see how many Americans, it's about half of people are really, really big. And it's not good. That just shows like a difference, I think, in Norwegian culture. Changing how you eat and what you do and how active you are. That is part of healthcare and being educated, but that really boils down to just American culture is really unhealthy. And that obviously leads to so many unnecessary deaths. You could say obesity is just a totally preventable unnecessary death for most people with proper habits. So anyway, there's clearly a lot that America could learn from Norway. A lot of things you guys are doing with your healthcare that is really impressive, really smart. You're saving lives more often. You're living longer, healthier. And there's just so much America could do better, and we should be doing better, and we should be talking about this, but it doesn't happen nearly enough. So I wanted to take a look at this, and I'm glad I did. I definitely learned some stuff, but it's also a bit depressing to see how behind America is with healthcare. So anyway, if you enjoyed this, feel free to give this video a like or leave a comment with your thoughts on Norwegian healthcare versus American healthcare. And if you're interested in more videos like this, me reacting to Norway and seeing Norwegian things I've never seen before, feel free to subscribe for more. And until then, thanks for watching, and see you next time.